Children no longer need to be born with HIV, and their mothers need not die giving birth. We know what works. Governments such as Rwanda are making this a priority.
Well, the program started in Rwanda in 1999 with one health facility in Kigali. It has been scaled up, and now we are reaching up to 90% of health facilities in Rwanda.
Inspired by a bold global plan, governments are taking action to eliminate new HIV infections in children by 2015 and to keep their mothers alive.
To have this elimination of mother-to-child HIV transmission, we need to work on different axes, if I can say axes or prongs. So in each prong, we have services or actions to be taken.
By preventing HIV among future parents, the cycle of HIV transmission to children is broken. Since HIV is the leading cause of death in women aged 15 to 49, preventing it has other far-reaching life-saving benefits. Young people are at particular risk, so counseling and services needs to begin before young people start having sex.
The program of addressing sexual reproductive health in Rwanda targets young people aged between 10 to 24 years.
Kwakira urubyiruko rero ruje kwakira service ziba hano zigabanije mu byiciro bibiri, hari VCT ari byo kwipimisha ku bushake, hakaba n'indi service twita teledikasiyo.
We have been working on sensitizing parents and caregivers on starting talking about sexuality at the earliest age as possible.
Women may be at increased risk of becoming HIV positive during pregnancy, so offering HIV counseling, testing, and condoms to pregnant women and their partners is essential.
Aka nagachi? Nagakingirizo kabagabo. Gerageza ubisobanure haguruka. Bakoresha agakingirizo muhe buryo.
Warangiza ugafata cyagitsina cyawe ukagishyira mu cyuhiro.
One of the game changers for HIV has been treatment as prevention.
Efforts of condoms, messages are not enough because we still have those cases. So what we have added in recently is to treat a positive partner in discordant couples with antiretrovirals, because now the science is clear that reducing the viral load, you reduce the transmission rate from the positive to the negative partner up to 96%.
Preventing HIV in pregnant women hinges on getting their partners involved. In Rwanda, 9 out of 10 pregnant women's partners go with them to their first antenatal visit to the clinic.
I think there are many reasons behind that success of men being involved in antenatal care and other maternal and child health issues. I think it's a little bit linked to the history we've had in Rwanda. People have been hurt by what happened, the genocide and all the aftermath of that. So for me, I think that has changed, prompted the mindset of the people in the way we take care of our families.
If the women say that it will be easy for her to bring the partner in the next visit, it's okay. But when he mentioned that there will be some challenges, the health facility sent an invitation to the partner to come to the health facility to receive services together.
Service duhabwa buriya nje cyemberekeje umudamu umunsi wa mbere badushishikariza kuza n'umudamu ku gipimo ari umunsi wa mbere. Ahubwo nakubwiye ko nageze hano ku nshuro ya gatatu, bwa mbere naje bwo bwa mbere, bwa kabiri bwo bwa gatatu.
Nanjye nabonye ari ibintu byiza cyane ko barushaho gukurikirana ubuzima bwacu n'umugore n'umugabo, bakamenya ko duhagaze ukuntu no gukurikirana rero uko umwana amerewe mu nda kandi twasanze ari ibintu byiza cyane.
Like all women living with HIV have the right to choose if and when they would like to have children and the type of contraception they would like to use.
Personally, and as a clinician, I think having an HIV does not limit your rights, doesn't limit your freedom.
Naje kuva ku izima ndagenda kwa muganga ndababwira nti ndashaka noneho nanjye kuboneza urubyaro. Banyigisha noneho ibyo kuboneza urubyaro, uburyo hari agapira ko mu mura, hari ako mu kuboko, hari urushinge, bambwira n'ibibazo bishobora gutera umuntu n'ibyiza byabyo. Barabidusobanurira nabwo twari twajyanye n'umugabo wanjye. Ubwo nitamo ndababwira nti mushyiremo agapira k'imyaka 5. Nimbyara nyuma y'5 nzaba ari sawa.
Women, regardless of pregnancy or HIV status, can get rights-based family planning information and services when and where they need it.
Umubyeyi ashobora kuza kwivuza uburwayi busanzwe agahabwa uburyo bwo kuboneza urubyaro yabanje kwigishwa. Umubyeyi ashobora kuza gukingiza umwana we akabona uburyo bwo kuboneza urubyaro.
In Rwanda, 1/3 of health clinics are supported by faith-based organizations. For religious reasons, those run by the Catholic Church cannot provide modern family planning. But working together, churches and local government have found a solution.
So near those fertility facilities, we have an agreement with the churches. With this agreement, the local administration put a secondary health post near the health facility managed by a Catholic Church, and this secondary health post is providing some services not provided at the health facility level.
For women living with HIV, a number of steps are taken before, during, and after the pregnancy to prevent HIV transmission to their child. These include taking antiretroviral drugs, plus safer methods of delivery and infant feeding.
Kwa muganga turabwira ati dukeneye akabebe turakuze, baratubwira bati ni byiza ugomba kwikurikirana kumvira icyo tukubwiye gukora. Ubwo nyine igihe kiragera ndatwita, barambwira kuko sanzwe imiti yo kunywa ubuzima bwose nta gishya bagomba kunkorera. Bambwira ati komeza imiti yawe, utwita inda y'amezi 3 ugomba kuza tukagupima n'umugabo wawe. Mugabo araza tuti se ko dusanzwe ubundi muradupimamo ibiki.
Iyo amaze ku igihe cyo kubyara kigeze, tuba twaramuhaye gahunda, turamukurikirana amavizita domicile we mu rugo ku buryo uko biri kose agomba kubyarira ku kigo nderabuzima.
The lives of mothers and their babies are intertwined, and women living with HIV and their families need services that extend far beyond pregnancy and delivery. According to their skills, clinic-based health providers and community health workers are jointly providing these life-saving services such as antiretroviral treatment, family planning, and well baby care.
Because community health workers are people elected by the population and also they are trusted by the population.
There are various approaches to using antiretroviral drugs to eliminate HIV transmission to children and keep women alive. Option B+, used in Rwanda, involves women living with HIV continuing to take the antiretroviral drugs they started during pregnancy for the rest of their lives. Instead of only relying on doctors to do this task has been shifted to nurses.
500 nurses are now able to provide ARVs. So those nurses can do a very good job in implementation of option B+.
Gatandatu ubwa mbere mfite inda y'amezi 3 nsanga narahuye n'ikibazo cy'ubwandu bwa sida. Kugeza n'ubu buri kwezi nzi kuyifata. Noneho gukurikirana umwana nabwo bamarandevu yarimwe mu kwezi nkaza bakamupima ibiro bakamuha n'imiti.
Health systems can be changed to better serve the needs of the people. Examples include integrating services, performance-based contracts, and health insurance. But all of this depends on strong commitment from the government.
As I said, the first thing to do is to have the commitment from all levels. And then after, if everyone is committed, I think everything new you bring in will work. We're trying to make one-stop services. So if a mother or a pregnant woman come to the health facility, once she's there, she finds all services in one place provided by one provider.
I had a chance to go in a health center to meet women receiving results of PCR, the test of HIV from the baby, and the test was negative. And I saw the woman dancing in the ground. I haven't seen anyone happy like that in my life. So that is something I want to see in the next future to all pregnant women in Rwanda and the world.